Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about infection after knee replacement surgery and what you need to know. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos. So when it comes to infection after knee replacement surgery, thankfully the vast majority of folks are not going to have an infection. The risk is relatively small, but there is definitely a risk there. So if you wanted a specific percentage, you might think about give or take 2% of individuals will have an infection after knee replacement surgery. A couple of good things to keep in mind is you can definitely reduce your risk significantly. A couple of the main ways are one, maintaining a healthy body weight, not smoking, controlling your blood sugars if you're diabetic or a pre-diabetic, and also just following all the instructions and the advice and recommendations from your surgeon and from your healthcare team, both leading up to your surgery and going into the surgery and the day of surgery, and also after surgery as well. Some other things to keep in mind is there are different types of infections after surgery, and the seriousness of them and the extent of the treatment that's required really depends on the type of infection. So first, there's superficial infections. These are infections that are superficial. They're at the skin level, at the incision potentially, most likely. And these are a little bit less serious and can be managed a little easier. Then you have deep infections, which is an infection of the actual knee joint itself, and the infection has gone down into the joint. This is a little more serious and takes a little bit more management, as I'll talk about in a minute. You can also have infections at any time after knee replacement surgery. So you can have them shortly after, within days or a few weeks after, or you may not have an infection until many months or many years after having your knee replacement. So always important to be aware of, what are the different signs and symptoms of potentially having an infection. And so let's get into that right now. So one of them is pain. So a significant increase in intensity in pain that is kind of beyond the level that you might expect. So certain activities, certain things are giving you really intense increased pain, and it's something that's something that's new. It's not something that you've been dealing with. It's kind of this sudden change, this sudden increase in pain over a day or a few days. Along with that is also swelling, kind of a significant or a sharp increase in swelling to the knee joint or the leg. You also want to look at things such as redness, discharge, or drainage from your incision. You want to look at if you're having fever or chills, as these are all different potential signs of an infection. Now, if you think you might have an infection, it's really important to reach out to your healthcare provider, as they have different tests that they can perform to really, one, determine if you do have an infection and it's impacting, and that infection is at the knee joint itself, and also the specific and personalized way to treat that infection. It's really not wise to try to manage it and take care of it by yourself, because the infection management is really going to be specific to what is causing that infection. So when you see your doctor, and if you see your doctor for potentially having an infection, they're going to run some blood work. They're going to take an aspiration, take some fluid out of that knee, and put that fluid through some tests to kind of see if there is an infection and what is causing that infection. And they're also going to run some imaging, running an X-ray, bone scan, look at the integrity of your prosthetic, of your knee replacement. Now, management is going to depend on a lot of different things, and again, it's going to be individualized and specific to your needs. If it is able to be managed just through some antibiotics, especially if it's a superficial infection, oftentimes a course of antibiotics is sufficient to manage it and get rid of that infection before it becomes a deep infection. And then with a deep infection, the potential for surgery is definitely there. And there's a couple different kinds of surgery. So one type is basically surgery where the surgeon goes in, cleans out the joint, cleans out the prosthetic, irrigation, debridement, gets rid of all the infection, and then usually you'll have IV antibiotics after that as well to clear out the infection from the knee. If necessary, a revision knee replacement surgery may also be a potential thing that will need to be done. And there's two different ways to do this as well. So one way is called a two-stage revision knee replacement. In this stage, the surgeon goes in at the first surgery and removes all the prosthetic components, cleans everything up, and puts in a temporary implant, or something that is referred to just as a spacer. And that's going to stay in there for a number of weeks. And then after that, once we know that that infection is cleared out, the integrity of the joint and everything around the joint is good, then they're going to put in a second surgery, that permanent knee replacement. So that would be a two-stage revision surgery. You can also have a one-stage revision surgery where the surgeon goes in, clears everything out, takes out the old prosthetic components that are compromised, cleans out the infection and irrigates and debridement, and then puts in the permanent knee replacement or the revision knee replacement components all in that one surgical procedure. Again, all of this really comes down to the specifics of what is causing your infection, what's the extent of the infection, what is the integrity of your prosthetic and the knee joint and all the soft tissue and structures around your knee joint. And so it's really important to consult with your surgeon, consult with your medical team about how to best and most appropriately manage and deal with an infection after a knee replacement. Now, the rehab and recovery after a revision knee replacement surgery is overall good and positive. Some folks, it does take a little bit longer, a little bit more effort to get to kind of fully recovered. There is a slightly increased risk of having some further complications or not being fully satisfied with your replacement. You just have to understand that this is now your second knee replacement, so nothing is going to be as good as that original knee that your body had when you were born. So there is going to be the potential for some lingering stiffness and pain, and you might not feel quite as strong or not have quite as much mobility. But by and large, most folks have a pretty good recovery after a revision knee replacement and are able to do a lot and function and have a good quality of life. So that's all you need to know about a knee infection after knee replacement surgery. What are the signs and symptoms to look out for, how it's managed, how it's treated. So I hope you found this video helpful. Please be sure to leave a like if you did. Leave your comments and questions below as I do my best to get back to everyone, and thank you for watching.